Okay? Okay. Ready to go?
Yes.
Yep. Okay. Okay, so here we go. So have the heart here, and in the cat you have, this is actually the aortic arch, but you can't see it because it's wrapped up still in the pericardium. So in the cat there's two branches that come off directly off of the aorta. There's the brachiocephalic trunk, and then the left subclavian. You can remember the left subclavian is left out of this whole other mass of vessels here. So in the cat, the brachiocephalic trunk, it's going to branch into three branches. You can see them well here. Right? 1, 2, 3. And so the one that's going to serve the right arm is going to be the right subclavian artery. So the right subclavian is branching off of the brachiocephalic trunk. As soon as it passes or reaches about the axilla, it becomes the axillary artery. And then as soon as it reaches the brachium, my blood vessel isn't very complete there, but as soon as it reaches the brachium, from here to here, it becomes the brachial artery. And then the brachial artery is going to branch into the ulnar, and then the radial artery. And that's where we're going to stop at there. And then, of course, so that was the right subclavian artery. And then you have these other two that are coming off of the brachiocephalic trunk. This is going to be the right common carotid. Anytime you have common, it's going to branch into internal and external carotids. It's the internal carotid that serves the brain and goes to that circle of Willis we'll talk about. This then is the left common carotid, same thing. And then that left subclavian here is just going to follow that same transition as the other one. It's going to become the left axillary artery. I don't have it dissected out well. And then the left brachial artery, the left ulnar and radial artery. Okay? And that's pretty much what we're doing up here at the top as far as arteries go. If we look at the venous system, you're going to have two, it's kind of like a V here. You have these two brachiocephalic veins. The brachiocephalic veins are from here to here and from here to here. Where the jugulars come down, the jugulars are the main brain drain. So they're going to come down, internal jugulars, come down where they join up with the brachiocephalic artery. That's where it becomes the brachiocephalic artery.
Okay.
So you have the jugular veins coming down. These are the same veins, same names, ulnar radial vein, brachial vein, axillary vein, subclavian vein. As soon as you pass the jugular, it becomes the brachiocephalic vein. The two brachiocephalic veins fuse together to form the superior vena cava, and that goes to the right atrium of the heart. Okay, if we come down here, back to the arterial system, I don't have the aorta dissected out well, but it has several regions. It ascends, it arches, and then descends. It's called the thoracic aorta in the thoracic cavity. When it pierces the diaphragm, I think the dye is not in it well, so it's hard to find it. But when it pierces the diaphragm, it becomes the abdominal aorta. And then the abdominal aorta is just going to give off many branches going to the organs. What I have dissected out here, at least, is part of the abdominal aorta here. And these are the kidneys back here. And again, I don't have it out on the other side. And these are actually the adrenal glands. Look how small they are. Yeah, they're not even on top of the kidneys like they are in us, and they're really small. So coming off the abdominal aorta, you're going to have, and this is not all of them, but you're going to have the suprarenal arteries going to the suprarenals. You're going to have the renal arteries going to the kidneys. And then this is your abdominal aorta here. Comes all the way down. All the way down. And then it's going to branch into the legs, the major arteries serving the legs. The other difference between the cat and the human is there's no common iliac arteries in the cat. It goes directly from the abdominal aorta to the external iliac artery. And then the external iliac artery is going to transition into the femoral artery. Femoral artery serves the leg here. And then when it gets behind the knee, again, I don't have it well dissected here, it's going to become the popliteal artery. That's going to branch into the tibial and fibular artery, which I will dissect out eventually.
And will you do the is it the gastron?
Oh, the, you talking about inferior mesenteric artery maybe?
Yeah.
It was the mesenteric. Okay, so there's going to be 3 vessels that are going to go to the gut regions. There's going to be the celiac trunk, superior mesenteric artery, and then the inferior mesenteric artery. The only one I have, and it's broken here, but it's the inferior mesenteric artery. And basically the superior one, or the celiac trunk, serves the foregut. Superior mesenteric is going to serve the midgut. Inferior mesenteric is going to serve the hindgut. And the only other system, I mean, besides getting through here and looking at, you know, other regions of the abdominal aorta, we're going to just do the hepatic portal system, and that's it. And I guess the other thing we could say is that the veins, you guys, are going to just pretty much be the same as the arteries. So then you've got your suprarenal veins, your renal veins, your inferior vena cava. These are actually, let's see. I want to say that the gonadal veins are actually up more by the suprarenal, renal, gonadal. They're after the renals, but I don't seem to see them here, so I have to kind of clean up a little bit more. And that's about it.